So this is part 2 of the video. I wanted to make part 2 because one got to be 20 minutes long, so I wanted to break it up. I didn't want to bore you guys with a long video. So now, as you see, as we left off, we have 99214, 99213, 99215, and the same over here with 03, 04, and 05. The difference between these two, if it's a 03, 04, 05, this is indicative that this patient is a new patient. Patient has not been inside of this practice, or at least not for the last 3 years. This is a brand new patient. When you get to having the 13, the 14, and the 15, this is an established patient. They've already been here before. So let's go through the leveling as far as how you know it's going to be a level 1, 2, 3, 4, 5. Most of the times, doctors don't code a level 1 or 2. That's just honest. You know, money-wise, level 1 or 2 means you really didn't do anything to the patient, for the patient, wasn't anything wrong. And a lot of times if you come into the doctor, even if it's just for a checkup, some things are going to be wrong. So you really rarely ever see a level 2. So we're going to start here at level 3 for an established patient. And then we'll go over to a brand new patient. So if you're trying to figure out if it's a level 3, and that's the good thing about E&M leveling too. You see the code is 99213, which means this is a level 3. Level 3 usually takes about 15 minutes for that physician to see that patient. The decision making, which is, the presenting problem, and how they're going to decide to handle the presenting problem. So it's going to be a level 3 if you have 2 or more self-limited problems, 1 stable chronic illness, an acute uncomplicated illness, and it gives you an example, cystitis or a sprain, something small. And also the history, how we went through the HPI in the chart, and it has elements of the history of the present illnesses or what's wrong with you. So if it has 1 or 3 elements, hey, it's a level 3. Your review of systems. If it's a pertinent exam of your review systems, or your physical exam, if it's an expanded problem focus, then it's going to be a level 3. If it's problem focused and they're expanding on their problem focus, it's going to be level 3. So 99214, you see how the time is increasing? The time is increasing as the level goes up, and the money that the physician is going to make off this patient also goes up. So now for 99214, you're going to need at least 3 chronic stable illnesses. 2 or more chronic illnesses, 2 chronic or 1 minor. You can have 1 or more chronic illness with exacerbation, chronic or minor. You know how you have asthma with exacerbation, like you're having an asthma attack or something like that? That increases the level because now you're getting to a more serious notion or difficulty when it's making a decision for the physician as far as in regards to what to do for you. So then, how this present chart, we had new problems. You see here is a level 4. It says undiagnosed new problems with uncertain diagnosis. If you see on the chart where they say possible, probably, maybe, things like that, that's the uncertain diagnosis. And then if they have an undiagnosed new problem, they came in today and I checked your blood sugar and I now diagnose you with diabetes, then you have an undiagnosed new problem. So you have acute illness with systemic symptoms. You have acute complicated injuries. Let's say acute kidney injury. That will count as an acute complicated injury. Now you see how it goes up as far as the components in the HPI. As if you look in the 99213, you only needed 1 to 3 elements for it to be a level 3. Now as you're getting more to the serious condition, you need 4 elements for it to be a level 4. The review of systems, you need to review 2 to 9 systems, whether it's your psych system, your neurology system, as we talked about in video 1, if it's your lymphatic system, if it's your cardiology, your cardiac system. You need to have 2 to 9 systems reviewed for it to be a level 4. You see where it says also PFSH, personal family social history. You need one of three of those. Or the physical. When we looked at the physical exam, it has to be detailed to the affected area and the related organ as to what's going on. And as you see, they spent 25 minutes with this patient. Now let's go on to the level 5. A lot of times you're going to see a lot of level 3s and a lot of level 4s. A lot of physicians try to code level 5s to get the money or to, or things like that, or to, push the claims out, and just being honest. But level 5s typically mean in the doctor's office, they're basically going to send you to the emergency room from the doctor's office. If they're not sending you to the emergency room basically from the doctor's office, then it's probably not a level 5. So let's take a look. So level 5 is going to be one or more chronic illnesses with severe exacerbation, progression or side effects of treatment. Acute or chronic illnesses or injuries posing threat, you remember I just said that, posing threat to life or function. MI, which is a heart attack, which is a myocardial infarction, pulmonary embolism, respiratory distress, abrupt neurologic status change, a TIA, seizure, weakness, sensory loss. That's basically stroke. TIA is basically a stroke. So when you look down here to make this a level 5, you need all of those things that I just mentioned, in addition to 4 elements in the HPI, 10 reviewed systems, one of each for the personal family social history, also a comprehensive general multi-system or complete single organ system physical exam. A comprehensive, which means they're going to go over all of your systems, or if they get to one system where you're having a problem at, and they do a complete single organ system exam, it's going to be a level 5. And as you can see, you see where they spent 40 minutes with this patient. So that's another thing to remember when you're taking the exam and things like that. The longer the patient is with the physician, probably the higher the level is going to be. And I also tell you to be aware when you're leveling. Some doctors like to put that they've been with the patient for an hour and they haven't did anything but gave them a shot. So you just have to be careful with that. You're responsible for making sure that the appropriate codes are on there. Your certification is on the line. That's why the physicians pay you, because you are the one that's supposed to be kind of abreast of these things no matter what they put. So let's go to the new patient. You see how it's 15 minutes for a level 3 for an old patient, but it's 30 minutes for a level 3 for a new patient. Do you know why that is? That's because when you have a new patient, you're generally going to spend more time with the new patient because you know nothing about this patient. You know nothing about their past medical history other than the medical records that they have sent to your physician's office from another physician's office that they attended. So you have to spend a lot more time with new patients to get to know them and know their history so you can give them quality treatment as a physician. So for level 3, as a new patient, we're going to need 2 or more self-limiting problems, same as the level 3 established patient. So you need 1 stable chronic illness, acute uncomplicated illness, and you need at least 4 elements for the HPI. 2 or 9 systems have to be reviewed when the doctor reviews the systems. And then when you have personal, your family and your social history, at least 1 or 3 of those exams have to be reviewed. And then as far as for your physical exam, make sure it's detailed in the affected area of the related organ. So now we're going to go to a new patient, 99204. So 99204, you're going to have 3 chronic stable illnesses. And I'll take a look back here so you can kind of compare the 2 on the side. So you're going to have 3 chronic illnesses. You're going to have 2 or more chronic stable illnesses. 2 chronic or 1 minor will work too. You're going to have 1, and I'll get closer so you can see. You're going to have 1 or more chronic illnesses with exacerbation, which can be chronic and minor. You're going to have undiagnosed new problem with uncertain diagnosis. We talked about that with the established patient. Acute illness with systemic symptoms. Acute complicated injury. Acute complicated, remember that. So you're going to need 4 elements to the HPI, 10 systems, 1 of each of the personal, family, social history. And then as far as the comprehensive general multi-system or complete or multi-system complete single organ, you're going to need that as well.